blockbuster drug for each form of degenerative disease. For osteoporosis, they have Fosamax, Actonel, and the bisphosphonate drugs, which I consider to be, quote, bad drugs. I don't recommend them for anybody. Number two, for heart disease, for atherosclerotic vascular disease, coronary artery disease, the drug companies have the statin drugs, Lipitor, Crestor, Baycol, etc., which are of questionable benefit for the vast majority of people taking them. For loss of immune function, our ability to defend against infection, we have a class of drugs called the antibiotics, which of course are one of the great triumphs of modern medicine, the conquest of infectious disease with antibiotics. Instead of taking all of these blockbuster drugs, another one which we should mention is arthritis. Osteoarthritis is a typical degenerative disease of the joints, causing pain and dysfunction, loss of function of our joints at the knees, finger joints. The drug companies have, of course, we all remember Vioxx, which was a huge scandal. Vioxx was eventually banned because it caused heart disease. Other types of arthritis drugs, which are available at the corner grocery store, are called NSAIDs, non-steroidal anti-inflammatory drugs, and my good friend Alvin Stein talks about these on No Bones About It. The NSAIDs include ibuprofen, Aleve, naproxen, even aspirin is considered an NSAID. So these are all anti-inflammatory drugs that are given out for osteoarthritis. They do give short-term pain relief, but they will actually cause progression of the joint destruction, which is not a good thing. So my point here that I'm getting at is that in a much better, far more logical and more effective approach to preventing and reversing degenerative disease, all of these degenerative diseases, is and will be into the future bioidentical hormone supplementation. Because remember, all these degenerative diseases are directly caused by declining hormone levels and our inability to regenerate new cells and manufacture new proteins, reparative proteins, because of declining hormone levels. So it makes eminent sense. I mean, it's extremely logical, and it actually does work in clinical practice to give the population at large, we're talking 50, 100 million people who are reaching the age of 50 and above. All of these people, in order to stay healthy, should be on bioidentical hormone replacement to maintain hormone levels in a healthy, youthful range, which will then reverse and or prevent the onset of these degenerative diseases. There are 3 studies in the male population showing that low testosterone levels carries a 40% increase in mortality. And there are studies in women which show the same thing. I'm going to go through a couple of these studies. First, we'll take a short break, and then when we come back, we're going to talk about studies which show that hormone deficiency in women is associated with increased mortality, and how replacing hormone replacement and replenishing to healthy hormone levels is associated with better health. So the best is yet to come. Stay with us. We'll be right back.
Dr. Dach's practice is one of the largest providers of bioidentical hormones and natural thyroid in the South Florida area. Dr. Dach utilizes conventional testing with Quest and LabCorp, as well as more advanced state-of-the-art testing with Metametrics and Intero Labs. Known for his personal attention, they spend more time with each patient and do more follow-up than any other medical practice around. They also routinely test for gluten sensitivity, heavy metals, food allergies, H. pylori, selenium, and iodine levels that most doctors usually ignore, and do extensive nutritional testing using organic acid and amino acid profiles, so they can provide a customized vitamin, mineral, amino acid program for every patient. Dr. Dach recognizes that many commonly prescribed drugs are of little benefit or may actually be harmful, and they switch patients from bad drugs to more effective and safer natural alternatives. Want to be treated like family? Then contact Dr. Dach for an appointment at 954-792-4663. That's 954-792-4663, or go to drdach.com. That's DrDach.com. Conveniently located in Davie.
And we're back to Staying Healthy with Dr. Dach. I'm your host, Dr. Jeffrey Dach. And we're talking about women's bioidentical hormones, why they're important, why they are important to maintain our health and stay healthy. One of these studies which I wanted to mention to you that describes this is a study done by Dr. Rivera on, and this was from the Mayo Clinic, published 2 years ago in the journal Menopause 2009. This was published by Dr. Rivera. She followed 1,000 women who went to the Mayo Clinic over 40 years. It's a very long study. 40-year study, 1,000 women followed from 1950 to 1987. And these are women who had hysterectomies and removal of the ovaries. The ovaries in women are the little factories that produce hormones. They're the hormone production factories. And if they're removed surgically, then hormone production basically stops in the woman's body, and they then have surgically induced menopause. They are thrown immediately into hormone deficiency. So this is an excellent way to take a look at what happens in hormone deficient women. And what they found was after the ovaries removed, there was an 84% increase in mortality from cardiovascular disease in women who were not given hormone replacement. However, in women who were given hormone replacement with Premarin, you remember that's the horse hormone that we talked about earlier, there was a 35% decrease in mortality from heart disease. I thought that was a fairly dramatic demonstration of the the adverse health consequences of hormone deficiency and the benefit of hormone supplementation. Another study, here's another one, published in 2009 in Obstetrics and Gynecology. This is the mainstream Obstetrics Gynecology journal. This was done by Dr. Parker from Santa Monica, California, St. John's Hospital in Santa Monica, California. And the article's entitled Ovarian Conservation at Time of Hysterectomy and Long-Term Health Outcomes in the Nurses' Health Study. This was data from the Nurses' Health Study. 24-year observational study of 30,000 women, very large study, after hysterectomy for benign disease. They all had hysterectomies, meaning they had the uterus removed, which is the hysterectomy operation. Half of the 30,000 had their ovaries removed along with the hysterectomy. The other half of the 30,000 women had their ovaries preserved. In other words, the surgeon did not remove the ovaries. He left them in at the time of the hysterectomy. Over 24 years of follow-up for women with the ovaries removed, there was a 12% increase in mortality. Increased mortality in women with low hormone levels. Remember, removing ovaries produces hormone deficiency and surgical menopause, 12% increase in mortality. So another example of a very long study of 30,000 women showing that hormone deficiency is associated with increased mortality in women. Let's look at, again, the Women's Health Initiative study. Remember we were talking about that earlier. That was a large NIH study which was halted early because they found that synthetic hormones cause cancer and heart disease. Well, guess what? There was a second part of the Women's Health Initiative study that has been pretty much ignored. This second part was published in 2004, 2 years after the first part, in the Journal of the American Medical Association. And this was done by Dr. Anderson of the Women's Health Initiative Steering Committee. And the second arm, they used Premarin alone because these 5,000 women had hysterectomies and did not require the synthetic progestin. The average age was 63 years, so these are older women. Two-thirds of them were older than 60, and they all had hysterectomies. And they were given Premarin and followed over a number of years, compared to another 5,000 women taking placebo. In the hormone-treated group, it's interesting. a lot of women are concerned about, well, what is the risk of breast cancer? Turned out that in the hormone-treated group, taking Premarin alone, there was actually 27% less invasive breast cancer than the placebo group. And the hormone-treated group had 94 cases. The placebo group had 124 cases of invasive breast cancer. Osteoporosis and hip fracture. There was considerable benefit in the hormone-treated group, as you might expect. There was 40% less hip fracture in the hormone-treated group. These are the women taking Premarin alone. There was no progestin. So the second arm of the Women's Health Initiative showed benefits in terms of better bone density, less hip fracture by a large margin, 40% less. And there was even less invasive breast cancer in the estrogen-treated group, which a lot of people find surprising. So as we said earlier, degenerative diseases of aging are associated with hormonal decline because we need hormones to regenerate cells, new cells, and regenerate, manufacture proteins, which includes the most abundant protein, which is collagen in the body. So lack of collagen production, of course, will have degeneration of all the collagen structures in the body. So it is my thesis and opinion that bioidentical hormone supplementation is a vastly more effective and safer treatment, which competes directly with the drug industry. All those blockbuster drugs by the drug industry will be eliminated and replaced by bioidentical hormone replacement, bioidentical hormones. Sometimes women will go to the doctor and say, I'm having these symptoms, I'm having anxiety, panic attacks, and the doctor will give them SSRI antidepressants. Anxiety and panic attacks, as we mentioned earlier, is a symptom of postmenopausal estrogen deficiency and should be treated with bioidentical hormones. Giving an antidepressant to a postmenopausal woman with anxiety and panic attacks is a misdiagnosis and a form of mistreatment, which should be halted. Here's a study which was published in the mainstream journal Endocrinology, 2005. This is the Journal of the Endocrine Society by Dr. Trent Lund of the Department of Biomedical Science, Colorado State University. And he talks about estrogen receptors and anxiety behaviors. And I'm quoting. This is what Dr. Lund says in his article published in the Journal of the Endocrine Society, which is the mainstream endocrinology literature. And he says, estrogens are well-established regulators of mood in humans and in animals, animal studies. In women, reduced estrogen levels, particularly at the time of menopause, are associated with depression, sleep disturbance, irritability, anxiety, panic disorders, and cognitive dysfunction. This is in the mainstream endocrinology literature, and this is what I found in clinical practice. This is true. Estrogen deficiency is associated with these mood disorders, anxiety, panic, depression, and giving estrogen supplementation, raising estrogen levels, will eliminate those symptoms. How do we know that? Well, there are plenty of studies showing that's true. Here's a study in the mainstream psychiatry literature, Archives of Psychiatry, 2001. This was published, this article called Efficacy of Estradiol, which is bioidentical estrogen, for the treatment of depressive disorder in perimenopausal women. This was by Dr. Soares, who is at the MGH, Mass General Hospital, Harvard Medical School. Their study was published in June of 2001, investigated the use of bioidentical estrogen for treatment of depressive disorder in women.